Afternoon, everybody, and welcome to this meeting of the Council of Governors of Lincolnshire Partnership NHS Foundation Trust. My name's Kevin Lockyer and I am the Trust Chair. If people are happy, then we will dive straight into the agenda. Any apologies for absence will be noted in the minutes. Similarly, declarations of interest will be taken as those separately declared, unless anybody has got any new declarations of interest they want to make now. If so, please do stick your hand in the air and we'll take those now. Your virtual hand, I should say. If there are none, we will then move on to the minutes of the last meeting. Just the meeting that was held on the 24th of April. Draft minutes have been circulated in the pack. Grateful if anyone's got any observations on points of accuracy or any matters arising that they'd like to raise. Please do pop your hand up. If there are none, could I ask please for colleagues to indicate that they're content for me to sign those minutes as an accurate record of the last meeting? If you are, just a yes or a Y in the chat will be perfectly adequate. Thank you. Fabulous. Thank you very much indeed. Let's move on then to, I've taken matters arising, move on to the schedule of actions. There is one open action on the schedule with an update on progress as noted on the paper and a number of actions completed since the last meeting. Happy to take any questions or comments on those if colleagues have any. If there aren't any, and they don't appear to be, we'll move on to the next item, which is the note of the minutes of the last Board of Directors meeting, which was on the 5th of June. Again, any questions on those? Carol. Don't know whether this is on that item or the one just gone, but sorry if I'm
on this
item. Up your hand. Go on.
Yeah, thank you. Cara Hagan, Public Governor for North Kesteven. No, it was just a query that follows on nicely, I think, from the last Council of Governors when we were talking about what is an emergency. I just wondered, it's mentioned in the board minutes, the Lincolnshire System Urgent and Emergency Care Board. And I've never heard of that. And I just wondered, where is that located and who runs it?
Okay. Sarah, would you like to respond to that?
Yes, absolutely. So thank you. Given our Integrated Care Board has sort of statutory responsibility for emergency responses, etc., in the county at present, it is chaired by the Integrated Care Board, has various partners in it, including East Midlands Ambulance Service, for example, as including members from the Hospital Trust, as well as ourselves, as well as social care, so that we can have conversations about patients who are clinically ready for discharge and then can be moved on. That reports, I believe, into the Service Delivery and Performance Committee of the Integrated Care Board. So we are represented, but it doesn't feed into our governance structure unless there's something relevant that needs attending to, if that's helpful.
Yes, it is. I've just never come across it before. Thank you.
Thank you.
Thanks, Carol. Emma.
Hi, good afternoon. Public Governor East Lindsey. Yeah, it was the, excuse the noise in the background, my dogs have just decided they're going to fight with one another. It was on 058.6 of the minutes to do with the learning disability and autism inpatient admissions. And I was just reading through all of that, and it said the Trust League for Learning Disability and Autism will identify whether there's any identification of inappropriate or avoidable admissions. And I just wanted a clarification on what would be classed as inappropriate, really, in that arena. And the avoidable, well, if you're already asking that question, if it's avoidable, well, what's been missed?
Okay, thanks for that question. I
Yeah.
do get that question. I will look to a colleague to answer that. But I would, though, if I may, just remind governors that for detailed questions on the minutes of the Board of Directors meeting, it's really helpful to have those notified in advance, not least because I don't necessarily expect all colleagues to have a copy of the minutes in front of them for this meeting. But if we can answer that question.
Well, I do apologise. I've been working full time, so you know.
Look, absolutely no need to apologise. And that was just a reminder for general consumption rather than specifically aimed at you. Now, I've got a number of hands up, but I'm going to ask Girish to answer first, because I'm not sure, Richard, whether your point relates to this or something else. So, Girish.
Yeah, thank you very much. I'm Dr. Girish Kunigiri. I'm the Chief Medical Officer. As Kevin said, I don't have the minutes in front of me. I have it, but I don't know which section it is. But from the clinical point of view, I know Richard Eccles is here, from the ICP, who will have more details. But any admissions, irrespective of whether they have neurodiversity, learning difficulties, we always make sure that if people are coming onto the ward, there is a clear purpose, and also admission will make a difference in terms of their journey. So that's the first point. And the second thing is, we always make sure that as much as possible, the care is always provided in the community, near to the home, where possible. And particularly with regard to learning disability, and also with autism, we have a robust process of working alongside the local authorities to ensure that whatever package of care is needed, that is robust before we think of bringing the patients into the hospital. So during that process, we make sure that the package of care is delivered in the community where it is safe and appropriate. Hope that helps. Thank you.
Thanks, Girish. Richard, was there something you wanted to add to that?
Yeah, Richard Eccles, stakeholder governor from the ICB. Probably worth mentioning, in my other life, I'm the SRO lead for learning disability and autism. So I just want to say an inappropriate admission is by nature an avoidable admission. So the work is around identifying where there were services and measures that could have been put in place earlier whilst in the community that would have avoided the admission in the first place. So we have a whole process around that, which I won't go into detail today, but we have seen an increase in admissions that could have been, intervention could have been sooner.
Yeah, thank you.
Thanks, Richard. I hope that's helpful, Emma.
Yeah, no, that's helped. Thank you.
And please don't take my comments as a criticism, just as I say, wanting to remind colleagues that we have established an approach to questions about Board of Directors minutes, and it's just to enable us to provide as full an answer as we can. Bex.
Yeah, sorry to be the bugbear of everyone again. I'm just reminded of jargon and abbreviations speak, because not everybody on the Council of Governors is fully aware of all jargon. And SRO, please.
Senior Responsible Officer, Bex.
Thank you.
Okay. Right, let's move on then, if we may, to the next item on the agenda, which, if I can make my technology work, is item 1.7, which are comments from the chair. Now, with apologies, I've got a number of things to mention this afternoon. The first is to welcome a number of newly appointed governors, not all of whom are here, I don't think, this afternoon. One of the disadvantages of the layout of this on screen is that I can't actually easily see who's here and who isn't. But those new governors are Richard Eccles, who colleagues will just have met, representing the Lincolnshire Integrated Care Board, and Councillors Collier and Sheard, who are representing Lincolnshire County Council. A reminder that the next Governor Development Day is this coming Monday at the Learning and Development Centre at Sleaford. I understand that we've got good numbers attending. Unfortunately, due to a family commitment, I won't be able to be there, but I know the Chief Executive is. So please, if you have got your name down for that, then do go, because they are good sessions. Also, on the subject of governor membership, governor elections are currently underway. There's an election for the service user and carer constituency, and by-elections for other vacant seats. I understand that the response so far has been positive, and some seats will be contested, which is good. I try to update the council at meetings or around activities that I've been engaged in since the last meeting. I can report to colleagues that I've visited a number of services since the meeting in April, including the Clozapine Clinic in Lincolnshire, all of our services in Louth and in Grantham, Maple Lodge, and a number of services in Gainsborough. Outside of LPFT, spent a really interesting day with an EMAS ambulance crew a couple of weeks ago, from which there were a number of kind of learning points around how LPFT can best position the kind of expert support we might offer to ambulance crews. It was a day very well spent. Again, a couple of weeks ago, 3 weeks ago, I think now, I spoke at an NHS strategy event in London, and had some remarks to make about transformation in the light of the 10-year plan. Well, what was then the expected content of the 10-year plan, which seemed to be well received. And then finally, I took the MP for Boston and Skegness, Richard Tice, to visit the rapidly building scheme at Norton Lee. It's always a pleasure to take people round Norton Lee and to see how quickly all of that is coming together. A couple of other things quickly to mention before, and do please shoot your hand up if you want questions about any of this. A couple of more general developments to note. The first, as I've alluded to, is the publication of Fit for the Future, the 10-year plan for the NHS, and worthy of noting that is the ambition for all trusts to become foundation trusts, and for those new foundation trusts and existing foundation trusts that reapply to have significant freedoms beyond those that we currently enjoy. So there will be some sort of reauthorization process for existing foundation trusts, but we know not what that will be. So we await further news on that with eager anticipation. There is also a suggestion in the 10-year plan that there will no longer be a requirement for foundation trusts to have a council of governors. Again, there's no detail behind that, either in terms of timing or how that will be implemented. But meantime, until it is, we're committed as a trust to continue to work positively with, and to engage our governors who, as colleagues will know, I always say add significant value to the way in which we do business. So we wait and see what the future holds as far as that's concerned. Bex.
Yeah, I just wanted to comment on that. We do actually have a group of lead governors and deputy lead governors from across our great nation, and they have been in touch with our government with regard to this. So I will report back when I hear further information.
Thanks, Bex. That's good of you. Do please share anything that you get. And that's it, I think, in terms of my comments. So any further questions or comments from colleagues, do raise your hands. If not, then we will move on to the external audit report from Mazars. Mark.
Hello, and thank you. So I appreciate there's a few new governors, so I will start at the beginning, but I won't go on too long, which I'm sure you'll be pleased to know. So my name is Mark Surridge. I am the partner in charge of your external audit. I work for this Mazars, and we audit around about 45 to 50 NHS bodies nationally, as well as about 105 local authorities. So we're deep into understanding the unique facets of public sector and public sector audit. I've been your external auditor now for a few years, and about this time each year I come back and give you a summary of the work that we've performed during the year and an overview of those conclusions. What I'm really conscious about is that our overall conclusions can get mixed up to the point that was mentioned before. A huge amount of jargon is involved, and a huge amount of technical language is involved, as well as legal speak, in order to get through to reporting something that is compliant with international standards and auditing. So I thought that in terms of a presentation and a discussion with yourselves, and you are welcome to ask me any questions that you like, I would really try and cut through this as much as possible. So the starting point, I think, that's really important for you to be aware of is, whilst we, you as governors appoint us, the culture and objective that we set our teams up in is that we believe in being independent, objective, and our conclusions are there to support the wider taxpayer through yourselves. And that gives us a place of true objectivity. Our responsibilities, broadly, that we have 3 responsibilities as your external auditor. We are responsible for issuing an opinion on the financial statements of the trust. We're responsible for issuing what's called a commentary on value for money arrangements, and we have wider public interest reporting responsibilities that are unique to the public sector. Now, if I give you those, I'm going to take them slightly out of turn because of it just increasing complexity around them, so that you can be assured on these. So some of our wider responsibilities and public interest reporting, these are really strong and wide-reaching powers that, if we enacted, would be indicative of something serious failings within the trust. I can confirm to you that we have had no need to exact any of those kind of powers this year. So that's good for the trust. Our second responsibilities sit around an opinion on the financial statements. And this is really important because it forms the basis of essentially sound financial planning and confidence in the numbers that come through the trust for its informed decision making. The majority of our work obviously goes through the audit committee as the primary responsibilities, because that's where we can really get under the skin and explain what we do, how we do it, where we see the need for us to focus, and which numbers are most susceptible for us of concern. I can confirm to you that we issued our audit report in line with the reporting deadline, and the best word I can use to describe it is it's a clean audit report on the accounts, clean. So again, that is a positive outcome for the trust and its underlying financial position. The third area of responsibility we have is the one that I'll take a tiny little bit more time over, because it contains the worst narrative description I think there is, in that it's our responsibilities of what's called the value for money commentary. And the most important thing I want to take away for you, sorry, the second most important thing I'd like you to take away is that we do not issue an opinion on whether the trust provides value for money or not. We don't do that because it's highly subjective. What one person believes is value for money could be different to somebody else's, and therefore it's very difficult to form that view. What we are responsible for is issuing a commentary and evaluating three areas. We consider the trust arrangements for financial sustainability. That means understanding how the trust puts together its financial plan, its underlying financial position, how it delivers and assesses cost improvement programs, and as well as aspects of budgetary control. We are also responsible for something called governance, and now that's about how well set up the board assurance framework is, risk management arrangements, the functioning of the audit committee, and the functioning of and findings of the trust internal audit team. The last area that we look at is something called, it's a bit of a mouthful, it's called improving economy, efficiency and effectiveness. And what that means is that there are appropriate processes and procedures in place to help agree a strategy, look at key performance indicators and track those, making and taking action as and when required. So essentially the performance management of the trust. We pull all of our findings together and we issue a detailed report to the audit committee and talk them through what we've looked at and why we believe it's relevant and appropriate for the trust. We consider things on a fairly binary level. So for the work that we do, we either say it's adequate or it's not. We don't grade things, again, we keep away from subjectivity. And then coming to the overall conclusion around this, our fundamental view of the trust is that it does have appropriate arrangements in place in all of those areas. So again, what I would say is it's a clean bill of health for the trust across financial sustainability, governance, and improving efficiency and effectiveness in use of resources. If I take a slight step back and think about the broader context, it does give you a chance, and it does give you governors some assurance over the organisation and how it's being run. It's not to say there aren't significant financial challenges, particularly facing the trust through the wider external environment, and going forwards with, you've already had a mention about the 10-year plan. There's going to be future challenges around there. But at this point, there are no significant concerns that we have over the trust and how it's run and how it is planning to tackle those. That is putting the trust in particularly around financial sustainability, that is putting the trust in an increasing minority, because the financial challenges facing the NHS, I'm sure are very well known. And we have seen an increasing number of organisations that aren't able to meet their financial targets and are not able to pull together a cost improvement programme that is sufficiently robust to bridge those gaps. So there's it is, I would say, a good news message. We wouldn't say get complacent, and we know the trust isn't complacent. But I thought that would be quite helpful for you as an overview, and I'm more than happy to take any questions.
Thank you, Mark. I think that was admirably clear and concise. Thank you. So I will open it up to colleagues to ask questions. Just to clarify for the Council of Governors, the ask here is that you simply receive the report. So in the absence of any questions or comments, we will take the report as received. But I encourage people, if they have questions or comments from Mark to raise them now. Karen.
Thank you, Kevin. Karen Scott, Trust Secretary at LPFT. Not a question, but more a comment and for information for governors. I just want to confirm that we have been able to receive this report from Mark this evening because our annual report and accounts have been laid in Parliament. We've had confirmation of that. In the absence of that having happened, we wouldn't be able to talk about them in a public forum. So just wanted to make sure that everybody was aware of that. Thank you, Kevin.
Yeah, thanks, Karen. That's an important observation. Thank you. Okay, I don't see any comments or questions from colleagues. So, Mark, thank you very much for presenting that and the clarity that you brought to what is, I confess, a complex issue or set of issues. So, thank you for that. Thank you very much.
You're most welcome. Thank you.
We will then move on. And to the next item on the agenda, item 2.1, just a highlight and exceptions report from the last meeting of the Council of Governors Representation Committee, which was on the 2nd of June. Bex, would you like to introduce this?
Yes, thank you very much. I'm Rebecca Metso, lead governor and a service user governor for the Trust also. I chaired the meeting on the 2nd of June and I put before the governors in the papers the highlights and exceptions report. One or two items from the report that I just wanted to sort of bring forward as a particular pleased moment for me is the increase in the iLogs coming through. I think we had 5 iLogs, and for those on the call who aren't aware of what those are, they are innovations, ideas and issues that are raised from our constituents and our governors and members of staff for our staff governors. So that's particularly good. And also a reminder that we will be getting the Better Together in August this year. It's due very soon. But as I say, just for information and a note that it is a recorded meeting. So if you weren't able to be at the meeting, you can actually watch the recording.
Excellent. Thank you very much, Bex. Any questions or comments for Bex on that? No, I don't see any. So we'll move on then, if we may, to item 2.2, highlight an exceptions report from the meeting of the Council of Governors Standards Committee on the 12th of May. Di, I think you're speaking to this.
Right, Kevin, thank you for that. So my name's Diane Bailey. I'm one of the non-exec directors here, I think in my capacity as Deputy Chair and Senior Independent Non-Exec, which is my role in the Standards Committee. The notes of the meeting are here for information, and I think it's pretty self-explanatory basically what we were what our business was on that day, which was to review the responsibilities and code of conduct for the directors and the governors. Most of the changes that were made were administrative and were really in terms of bringing these documents up to date in terms of some of the nomenclature that had changed around positions and standards. So that was it really, Kevin.
Thanks, Di. I'll take any questions or comments from colleagues if they have any. I don't see any, so thank you very much, Di. We'll move on then to the next item on the agenda, which is 2.3, Samantha, the Governor's Activity Report.
Thanks, Trust Chair. So I'm Samantha Swindell, I'm the Governor and Membership Officer, and I'm presenting the report on the Governor's activities for last quarter. It's a record of activities that are undertaken by all of our governors. It's not including main meetings that are minuted, but it does show you the other activities that governors are getting involved in, and it is an interesting read in terms of what those things are, particularly for our new governors who might want to have a go at some of these activities and get involved. So I'm happy to take any questions, but it is for information and discussion as necessary on any of the specific activities for update.
Thanks, Sam. Bex.
Yeah, it wasn't a question, it was just a very nice invitation that came in May this year during Dementia Awareness Week. We were invited by South Lincolnshire Dementia Support to actually go to their art exhibition in Bourne, and Carol Hagan and myself went down and spent the afternoon and met lots of really talented people in Bourne and surrounding areas who take part in that group, and it was nice to be invited.
Fantastic.
Thanks,
Sounds like it was very good. Okay, shall we move on then, Sam, to the iLog?
Yeah, so the next report is the iLog report, and that is to provide an update to the council on any submissions that we've had over the last quarter. For the purposes of the new governors, the iLog is issues, innovations or ideas that have come in the last quarter from the membership through to governors, or from governors themselves. As Bex alluded to a bit ago, we have had an increase in those, and it's pleasing to see. We've also got some very comprehensive "you said we did" format on this for the meeting today, for people to see what came in and what we did with those. So if anybody's got any questions, I'm here to answer them. This report is for information and discussion as necessary. Thanks, Chair.
Thanks, Sam. Emma.
Hi again. I'm a Public Governor East Lindsey. Actually, I had my hand up for the last bit.
I thought you might have done. Sorry, it's not obvious in the way that this screen is laid out. If I can't see your picture, I can't see the hand, unfortunately.
Yeah,
I would never dream of ignoring you, Emma. You know that too well.
Best, yeah. But yeah, it was just to say, I think it's wonderful that everybody's managing to do stuff and everything else. But I just wanted to add that in the background, I have been handing out leaflets and taking them with me to my work meetings with Carers First and other stuff as well. So it's not necessarily an activity, but I've kind of just been doing stuff in the background, which is not necessarily in East Lindsey either, because my work tends to put me in Boston. So it was just to say, you know, if you're going anywhere, take a stack of leaflets with you and, you know, just ask people if they're a member or not. And if they're not, well, you know, have a chat with them about the leaflet that you got stashed in your handbag, and, you know, see if you can get them to fill it in there and then, or get them to go on the website. It's just sort of the more people we get as members, you know, it helps shape services and gets people's opinions and ideas, you know, and all that. So that was just that bit I was going to say, and that was all.
Yeah, thanks, Emma. That's really helpful. Thank you. Thanks for that. So we'll move on to what I hope is a question about the iLog, having moved on peremptorily there. Carol.
Carol Hagan, Public Governor for North Kesteven. Thank you, Kevin. It was just that last night at the pre-meeting, I made some comments about the iLog, and we agreed that it would be useful to share them in this meeting. I was involved this time in quite a deep way in writing 4 ideas from a member of the public with Sam. And I just wanted to say that at the time, you know, it seemed to be quite a long process and it had to be right. But I can actually see from the issues and the responses given by the Director of Operations that the iLog system is very, very good, and it does need to be watertight. It does need, you know, that the issues are well answered so that nothing is left undone. And I can see from having been so involved in this process this time, what an excellent tool it is for people to raise issues, and that anybody, any member of the public can raise an issue with LPFT, but also the writing it up and presenting the issues to be answered by the Director of Operations. It needs to be good. It needs to be well written, and the responses, again, you know, watertight and no room for ambiguity. So I found it, as a public governor, a very interesting exercise to be involved in. I haven't been involved so deeply in the iLog process, and it is excellent.
Thank you, Carol.
Thanks, Carol. Thanks for that positive feedback. And it's good to have a bit of assurance around the rigour of the process. I think that's really helpful. Thank you. So I don't think there are, and thank you, Sam, for that too. I don't think there are any more questions or comments. So if we may, then we'll move on. Thank you, Sam. We'll move on to item 2.5, which is the Governor's Values and Behaviours Charter. Karen.
Thank you, Kevin. So just by way of a little context, the Trust revisited its existing values back in 2024, actually, and following a really robust engagement process, which included governors at the time, it launched a new set of values in January this year. Teams across the organisation, that's staff teams, were then invited to actually consider those values and what they meant to them, and link to that their behaviours as a team. And as we had done in the previous, on the previous occasion of this, of the launch of the Trust values, we extended that naturally to the Board of Directors and the Council of Governors. So the Council of Governors first embarked on that at its Governor Development Day in April this year. That was then helpfully facilitated by our organisational development team, and that was taken to the Governor's Representation Committee meeting more recently to discuss and for governors to consider whether it was a true reflection of what they'd discussed and agreed. There were some further amendments made following that, and I'm pleased to present to this evening the Governor's proposed values charter. And the ask is that governors agree that that's a true reflection of their work and that they will adopt them and work towards them moving forward. Thank you.
Thanks, Karen. First of all, can I invite colleagues to comment or ask any questions about that if they have any? Bearing in mind, as you say, Karen, this has gone through several coats of thinking about. Carol.
Hello, Carol Hagan, Public Governor for North Kensington. Just to say, it's really good to see that our comments were embraced and our additions noted, and it's lovely to see them in now the current Trust Governors Charter.
Thanks, Carol. It's really helpful.
Carol. Yeah, thank you. I don't see any other questions or comments. So can I then ask colleagues to indicate in chat with a simple Y or a yes or whatever takes your fancy that they are content to approve the document as presented by Karen. Fantastic. Thank you very much. Thank you to everybody involved in producing that. Thank you, Karen, for presenting it this afternoon. It's excellent, and I know it's got here this afternoon, as I say, having had quite a lot of work put into it, so I'm really grateful for that. Thank you. We'll move on then, if we may, to item 3.1, which is the Chief Executive's report. Sarah.
Thank you, Chair, and apologies, colleagues, for not introducing myself earlier. I'm Sarah Connery, I'm Chief Executive here at the Trust. Just want to reiterate Kevin's points about a very big warm welcome to our new governors today. This is my usual report where I give update on key local, regional and national issues, and further to Kevin's comments as well. There is certainly a lot going on, so I apologise about the length of the report. I do always struggle with making sure that I'm as concise as I can be when still making sure that I am updating you on any relevant pieces. Just to say, it's not included in the report, but very much front and centre in our minds at the minute is the upcoming industrial action. So resident doctors' strike starts at 7 a.m. tomorrow morning and goes on till 7 o'clock next Wednesday. So just for some assurance, our medical and people teams have been working very closely together, as well as our operations colleagues, to make sure that any impact to our services are as minimal as they possibly can be. This is maybe not the end of strike action for this year. We were hoping to have seen the back of it, but we have had lots of experience now in terms of making sure that we are running services as safely as we possibly can, potentially with a reduced resident doctor workforce. So I'll update you at the next meeting around that. As Kevin has said, the 10-year plan was released. I've included a link in the report. I won't go into too much detail today because I have allocated some time at the Governor Development Day on Monday for us to talk about this. So next steps, key for all of us here at the meeting today, is around making sure that we do a read across with our trust strategy to make sure that we're focusing on the right things in the right way at the right time. So we'll be arranging a future session on that. I did just want to point out, as part of our performance reporting, the new National Oversight Framework, which has been released for 2025-26. It is only a year framework because it's kind of a bit of an iterative new approach. So there will be a revision for 2026-2027. They were due to be published in terms of the segmentation. So again, I will talk about it in a bit more detail at the Governor Development Day on Monday. I think it's really important that all of our governors understand how the trust is being segmented and reported. But I will just say we are forecasting a deficit plan for this year, and on that basis we can only be achieving a 3 and no higher. So it goes 1, 2, 3, 4, 1 being the best, 4 being the worst. For particularly challenged organisations, there is a segment 5, but we will be limited to achieving a level 3 until we're able to turn our financial position around. Further to the point about financial position, I spoke at our last joint board, and we had a really good conversation and had presentations from all of the exec directors around our Living Within Our Means programme, which is very much our sort of 2 to 3 year roadmap in terms of financial sustainability, making good progress around our support services redesign programme. We have been tasked by NHS England to show a 50% reduction in our corporate costs growth since COVID. We do have to push ourselves further given the scale of the financial challenge, as Mark from Mazars has highlighted. This is a very challenged financial position, more challenged than we've ever seen at the Trust before. I want to say a big thank you to all of our colleagues who've responded so well. One of our principles of our programme, as we talked about at the joint board, is to make sure we're making savings as far from the patient as possible. But there has been a lot of work, a lot of consultation, real fantastic support from our staff side colleagues to our staff. So just want to say a big thank you to colleagues for that. do also want to point out we have been successful. We've spoken previously about increasing research investment for mental health into Lincolnshire. We have submitted in partnership with the University of Lincoln a bid for to be a mental health research unit, and we have passed the first marker. We won't find out till September, but please do keep your fingers and toes crossed for that, because that will be really positive for Lincolnshire if we're able to secure that investment. Just to give a bit of a service specific update, we have been operating NHS 111 now over a year. Given the evaluation of the activity, we took the decision with our integrated care board to step down the mental health matters helpline, which had been sort of running since COVID, because the activity can now be sort of picked up by NHS 111 as an alternative option. It's a number that everybody knows, it's well known. We will be evaluating the service, given it is still in its infancy, but getting really positive patient feedback. I visited the team a few weeks ago over in Grantham. Real patient-centred care and simple access, which of course is what we want to make sure that we've got here in the county and across the country. Further to Emma's point about reach of governors, I have included a link in the report, but just to say a bit of a shameless plug again for the How Are You Lincolnshire website, which is a really great website link, including lots of support offers for people. And it's sort of based around people's district councils, with the understanding if you know who owns your bin, you know which district council that you're in, and lots of information about community groups that you can get involved in there. So please, governors, do share that around for your constituents. I do just want to say we have had the Care Quality Commission visit our adult acute wards. We were quite disappointed with some of the findings. Just to be specific, they'd found some instances where we have had rapid tranquilization delivered to some of our patients without the correct documentation being completed. For assurance, we have inspected each of those instances. All of them were clinically indicated, so rapid tranquilization was appropriate. It's just that we hadn't completed the relevant documentation, but it is simply not good enough, and we have taken some urgent actions to make sure that that doesn't happen again, making sure that we're doing daily audits, making sure that we are training staff accordingly, and trying to make processes as easy for staff to follow as possible, but making sure we're really engaging our patients in the care planning around rapid tranquilization. I think I'll stop there, Kevin, if that's okay, but I could go on. Lots happening, but really happy to take any comments or questions on anything in the report or anything that other people have seen in the news. So thank you.
Thank you, Sarah. And you're right, there is an awful lot going on, and you've presented a report that covers a lot of territory in a very concise and helpful manner. So thank you very much for that. I'll take questions and comments from colleagues. Bex.
Yeah, it was in relation to the cost improvement process and the living within our means side of things that I wanted to just make a comment. And it's really a huge thank you to all those people that have been involved in consultation processes, in SIP meetings. I'm part of the panel for one of the SIP meetings, and I know I had a 5-hour meeting the other week. Yes, we did have breaks, but as I say, there's a lot of people doing a lot of really hard work, difficult work, and they should have a pat on the back from the Council of Governors.
Thank you, Bex. Absolutely echo that. There's an awful lot of hard and difficult work going on across the organisation as you describe, and I'm happy to take your comment as a pat on the back from the Council of Governors. So I know that will be appreciated. Thank you very much. Any other comments or questions, please? No, I don't see any. So thank you very much, Sarah. Thank you for that. As ever, you've covered a lot of territory and in a very concise and easily digestible way. So I'm really grateful. Thank you.
Thank you.
We'll move on then to the performance assurance report. Di, you're going to kick this off, aren't you?
Thanks, Kevin. So yes, Di Bailey, kicking this off in my role as Deputy Chair and Chair of Performance Committee. So just a few words to sort of preface the report, really, particularly as we've got some new governors joining us. So welcome to that, and also for folk who might need a bit of a reminder. So the performance assurance report is looking back. It's looking back over the committees in the last quarter. So if you've looked at the detail in the document, you'll see that the reference is made to committees that happened around about April, May time. Obviously, some things have moved on since then, but for the purposes of governance, it's backward looking. If we're doing it right, what you should be able to take from this report is that there is a synthesis of information across those committees that show that we're looking at the same sorts of things, but from different perspectives. So through a quality lens, through a best use of resources lens, through a people and then from performance lens, and then having the audit committee there as a kind of safety check to to sort of give us that assurance. And on that note, we'll be talking a bit more about assurance at the Governor Development Day, Kevin, which you and Sarah have mentioned next Monday. So if anybody's got any sort of detailed questions about that, we can perhaps pick that up on Monday. So what we tend to do is we tend to go through this report area by area. Each of those areas are looking at particular performance measures that relate to quality or relate to people. Some of those are set externally by the NHS executive, or some are set locally by the ICB, Integrated Care Board, and some of them are measures that we choose to look at as wanting to really understand from our perspective the things that we are interested in. So this report should give governors a sense of that alignment between the various committees, and that we as non-execs and chair of those committees are ensuring that the board are focused on the right things to deliver best performance. Now, just before I hand over to my NED colleagues to talk you through the relevant sections, just one last comment, again by way of orientation. On this occasion, because of where we are in the annual reporting cycle, you've got some additional assurance with the report, because what you've also got are the annual reports from each of those committees. And what those reports do is check that those committees are acting in accordance with their terms of reference. So I hope that helps just to orientate colleagues. So we're going to start by going to quality. And as we have apologies from Sarah Whiteman, who normally chairs Quality Committee, Tim, I think you're picking this one up.
Correct. Yes. Thank you, Di. So Tim Harry, non-exec director. And as Di said, I'm a member of the Quality Committee. So I'm presenting on behalf of Sarah Whiteman, who's the chair of the Quality Committee. And also, as Di said, you've got two documents relating to the Quality Committee this time, the annual report and the report from the Quality Committee meeting of the 17th of April, where the annual report was actually considered before going forward to the board. What I'd actually like to do is start with the annual report to give that sort of broader context for the committee work. So in the report, it's a pretty short report, but it covers all the key things around it. I'm not going to go into all the detail, but at the bottom of page 1 and over on page 2, it sets out the purpose of the Quality Committee. It then lists the subgroups that feed up and escalate items as required to the Quality Committee. And we scrutinise 5 key topic areas. And I just want to highlight a couple of things that came out over the year. So one of the areas we look at closely is the Quality Strategic Delivery Plan. And like some of the other areas around the strategic plan, this was quite ambitious, but good progress was made. I think there are about 60 actions which are either in work in progress or complete. And there are 9 which are either under review or yet to be started. But I think what I would emphasise is that the plan was ambitious in the first place. So I think actually it's been done well. The other elements that we scrutinise are 3 of those relating to patients, and you see those listed there. And then a strong theme throughout the year was a learning, both from internal learning and external learning, and in particular where there were issues or incidents in other trusts, some of which you would know from a national perspective. And we were very keen, obviously, to understand what had occurred to ensure that we learned from those and implemented any improvements that we could. So I think in summary, over the year, good progress was made. Moving on to the meeting of the 17th of April, you've got quite a number of areas where we discussed items, and we've separated those into 2. So there were 6 areas where good assurance was obtained, and including the response to the Valdo Calcine report. So that was an example of learning from external events. 5 areas where there was only partial assurance obtained. So obviously, as a result of that, we asked for follow-up assurance to get to full assurance. And then finally, I just wanted to draw your attention to a couple of further things. We live obviously in challenging times, particularly finance and resources. And the Quality Committee has a pivotal role in this to look at any potential quality impacts as a result of resource issue, and to escalate and highlight those up to the board where required. I think the other move in the Quality Committee is there's going to be a greater focus on clinical effectiveness moving forward. And Girish, as Chief Medical Officer, is going to sort of kick us off at the next meeting, sort of around that. So on that point, I'll stop and obviously take any questions or comments.
Thanks, Tim. I'm not seeing anything, so I think you were comprehensive. I think we can move then to the next part of the report, which is the best use of resources committee. And I think, Ian, you're picking this one up in Chris's absence. I can't hear you, Ian. I don't know whether that's...
Beg your pardon. Can you hear me now?
Yes, we can.
Yeah,
Thank
great.
you.
Sorry about that. Yeah, I'm Ian Orrell, one of the non-exec directors. I actually, although I'm not chair of this committee, Chris Wright is, who can't be here today, but I do sit on this committee, so I've got a good feel for the work it gets involved in. Thanks to Di and Tim earlier in terms of setting the structure. I won't go over that again, but if I can just bring out some of the points that Chris has made in his report, and I think it's the point he's made are very succinct, and then I'll touch on the annual report that's attached. In terms of the meeting that Chris refers to, it's the one that took place in April, and the points he highlights, understandably, is the committee undertook an annual self-assessment to ensure that it was effectively covering all the issues that had been agreed for it in terms of its terms of reference, and I think that demonstrated a strong outcome. And then in terms of the agenda that particular day, where there was quite a number of items that we covered, the main three I would suggest that got the majority of the time were, first of all, discussions around the organisation's financial sustainability. And we saw quite a lot of information on benchmarking and how costs are being apportioned in order to help us inform some of the work we're doing in terms of financial planning, and indeed the things you've heard about already about the Living Within Our Means initiative. On top of that, we also received some reports on estates, where we are making good progress in a number of areas. And we also received a report on our emergency preparedness and resilience, and that again was shown to be strong. So the theme, I guess, in this for me is, if we link it back to the sorts of things that our external auditor was saying to us half an hour ago, you'll see that this sort of work is a key building block to get us to the position where the auditor can say the sorts of things about us that he said earlier. So it's really important work. And the attached annual report just goes into more detail on this. It highlights the extensiveness of the terms of reference for the group, talks about the breadth of things that it's covered, and I've mentioned some of them, but there are also quite a number of other areas. And also, obviously, it's important that the committee itself has the appropriate membership of not only NEDs, but also, of course, executives. So that's about as much as I wanted to say. I hope that's been helpful, and I'm quite happy to take any questions.
Thanks, Ian. Again, I'm not seeing anything, so I think take that as comprehensive. Thank you. So I think we're back to Tim for People Committee.
Yeah, thanks, Di. So obviously Tim Harry, non-exec director and chair of the People Committee. So I'm going to do as I did with the Quality Committee and take the annual report first. And in parallel, it sets out the role and purpose. The People Committee has 7 subgroups that feed into and escalate items. And we have 9 areas that meetings and agendas are structured over. Just putting out a couple of highlights from those. As with the quality element, the People Strategic Delivery Plan was ambitious, but really good progress has been made around that. Equality, diversity, inclusivity has been a key theme. Progress has been seen, but there's still challenges around that, and we need to be tenacious and persevere. We had a number of deep dives, and that's been a consistent feature of the People Committee. We like to do deep dives, and often that involves staff stories. So an example was a deep dive on managing absence. And this is also an example of cross-committee work, where it was initially discussed at the Performance Committee, and I agreed to take an action and look at it in more depth at the People Committee. And then that's been an iterative process that has gone on. So I think in summary, positive progress has been made. I think there are ways that the People Committee can obviously be more effective and improve. I'll just give one example around that is, I think, absolute clarity from the committee in terms of what it's asking for from authors of papers, and also getting agreement about what's the most effective way that some of those areas can actually be presented. It's not always in a formal written report, although that's often required because that's the format that sometimes has to go through to the centre. But quite often a presentation may be a more effective way of doing it. Moving on to the report from the meeting of the 24th of April. General comments. Over my time with the People Committee, and it's probably a bit longer than I care to remember, but when I first started, there was a real focus on around recruitment and retention. Quite rightly, you looked at the data and there were some real challenges there. That has moved on significantly, and whilst we still look at recruitment and retention, and in particular sort of hotspots of where there are vacancies, there's more of a focus now about new ways of working and new roles. And this is really important because it ties in with the Living Within Our Means programme. So again, it's another example of cross-committee work. But part of the way that we'll address some of these challenges is around those new ways of working and roles. We also spent a lot of time looking at the National Staff Survey results. Amy and her team give us a really good analysis, and that's developed further. But I won't go into detail on that because that's the next agenda item, and Amy certainly knows a lot more about it than I do. But again, Di, I think that's about it.
Okay, thanks, Tim. Again, comprehensive, thank you. I'm not seeing anything. So I think we move to Performance Committee, which is yours truly. Just to clarify, you'll see 2 meetings for Performance Committee, one in March, one in May. That's because this committee meets bi-monthly, whereas the other committees meet quarterly. And what is interesting, I think, when you look at these 2 meetings together, is that it gives you some reassurance that there is consistency in terms of what we're looking at, but also I think it shows some progress between the 2 meetings. So, for example, at the first meeting in March, we still had a level of flux within our out of area placements, but by the time we get to May, some of the measures that have been put in place to manage some of that flux are obviously beginning to embed, and we've subsequently seen our out of area placements remain low, which is good news for us and absolutely where we want to be. So that's a highlight really for us, and that work will continue. And I think we recognised by the time we got to the May meeting that actually the focus that had been put on to that area of work had really started to pay off. Tim's mentioned that we asked people to committee to work and have another look around staff absences, and again you can see that by the May meeting we're reporting some improvement across all workforce metrics around absences, vacancy rates and retention. So again, concerted efforts to improve performance in those areas. Some good work going on around our estates and the solar panels at Discovery House, releasing benefits for us, and also in terms of whilst we still have some challenges around some of our wait times in certain areas, again we understand what they are and there are plans in place to do something about it. One of the most challenging areas, I think, for us is the number of people who are clinically ready for discharge on our wards, and obviously we don't want to keep people in inpatient facilities any longer than need be. Some of that is related to the dearth of suitable accommodation in our communities, and colleagues will be aware that, or existing governors will be aware that we've got a plan in place to commission some more step down accommodation, which should help with some of that discharge activity going forward. So just in terms of the annual report for Performance Committee is the youngest of the committees that we have. We've been in situ now for about a year, or just over a year, 18 months probably. Karen will correct me if I've misremembered that one. We've been evolving along the way. We're still evolving in terms of the performance metrics that we're looking at, and as Sarah Connery has also mentioned earlier in the meeting, with the new National Oversight Framework metrics coming in for 25-26 and then subsequently for 26-27 in Performance Committee, we're having a look at that in terms of how that, how we might need to change. But in terms of what we focus on, but in terms of the annual report, I think we were pleased with the way that we'd evolved over the last 18 months, and we did feel that we were meeting our terms of reference whilst recognising that we still had work to do. So I'll stop there if anybody wants to ask me anything about Performance Committee. I'm not seeing anything, so I think then we're moving to Audit and Risk. And Ian, you're back, and we'll be doing a double act on Monday as well, so people will see us again there.
Yeah, thanks, Di. That's the first thing I was going to say, actually, is I hope to see quite a few people on Monday with that double act between Di and myself. Ian Orrell, the chair of the audit committee, in terms of this report, it refers to the meeting we had back on the 1st of May, where at that time, I think the key things to say are that there were no specific issues that needed to be escalated by way of any governance issues. We also had early sight of some of the changed arrangements we've put in place around risk management, management of our BAF and our organisational risk register, and it was good to see that progress being made. And I'm jumping the gun slightly, but we're seeing that more and more, and it's key for us in terms of our overall governance arrangements. The other thing I would say about that particular report is it coincided with what I always refer to as the annual report season. So it's that time of year where there's a lot of activity around the audit committee, largely in preparation for the external auditor to come along and hopefully give us a good assessment, as we've heard before. So we're very much engaged in preparation for that, but also looking at things like, were we complying with the code for NHS trusts? What were we hearing from the chief internal auditor as opposed to the external auditor, and so on? And all this drives towards the sort of opinion that you heard earlier from external audit. In terms of sort of widening that out, the audit committee has also got its own annual report attached to the papers. And you'll see there that the heart of this area of work is ensuring robust governance arrangements, and hopefully you'll see from that how we go about that particular process. But there's also a key role in ensuring the effectiveness of the auditors around the organisation, both external, internal, but also the corporate fraud auditors. One of the things I just wanted to highlight as well in terms of our annual report was there's a reference to policies, and policies in terms of the development and strength wasn't something that we were particularly proud of a couple of years ago, let's say. That's now moved on, and again we're beginning to see a real strengthening of that area. It is a key area. And the final thing that I'd just say that gives a slight edge to the membership of the audit committee as distinct to some of the other committees is clearly we have the NEDs on the committee and also appropriate exec directors, but the committee is always attended by our key auditors. So we also hear the external view of the organisation at every meeting. That's probably as much as I wanted to say, Di, but happy to take any questions. Thanks.
Thanks, Ian. I'm not seeing anything, so Kevin, I think the floor is yours to conclude, if you will.
Thank you very much, Di. Thank you for guiding us through all of that. What I normally say at this point, and I'll say it again for the benefit of new governors, is that we present the performance report in this way to enable governors to discharge their responsibility to hold non-executive directors to account for the performance of the trust. And the purpose of presenting the report in the way that we do is to demonstrate the level of assurance that we have through the board's committees and the breadth of the activity of those committees in order to inform that level of assurance. The one thing I would say is that the addition of the performance committee has provided that ability to do much more kind of cross-committee interrogation of performance and issues, and that was illustrated in Tim Harry's remarks a few moments ago. So I think from all of this, I would suggest that the Council of Governors has got, is able to take significant assurance that the non-executive directors on the board are appropriately and rigorously holding exec colleagues to account for the performance and other activities of the trust. I'm happy to take questions. Carol.
Thank you, Carol Hagan, Public Governor for North Kesteven. Yes, it's all incredibly impressive, and I think that we know this is just some of the activities that the committees carry out, and I think we can be reassured and assured that the work is fantastic. I'd asked at a previous Council of Governors meeting if governors were allowed to attend any of the committee meetings, and Sarah had actually said that I would be welcome just to observe one of the quality meetings, and I wondered, can I go ahead and ask Sarah if that would be okay?
Yeah, of course.
Thank you.
Karen.
Thanks, Kevin. It was just on the back of Carol's question, and I think I possibly responded at the last meeting as well on that point. And just to say that as a trust, it's not regular attendance by governors at board level committees, hasn't been something that we've adopted or necessarily intended to. I think ad hoc observation would be supported. And Carol, I'm more than happy to be the conduit between yourself and Sarah Whiteman in relation to that.
Thank you. I'll drop you an email.
And just for your reassurance, Karen, that's exactly what I heard Carol request was, ad hoc attendance rather than regular. Yeah. Good. Thank you very much. Thank you, Di. Let's move on, shall we, to the next item on the agenda, which is item 3.3, the National Staff Survey results. Amy.
Thank you, Kevin. So I'm Amy Beaton. I'm the Chief People Officer here at the Trust. And I'm here to talk to you today about the National Staff Survey results. The National Staff Survey is an annual mandated staff engagement survey. So it has approximately 100 questions in it, and they're grouped into those 9 areas that you see on that first page of the report. So we get scores assigned to each of those 9 domains that you can see there. And that enables us to track our results and progress against previous year's scores, so we can see if we're improving. And also nationally, those scores are benchmarked with our peer organisations. And also some of the data is compared with all NHS providers as well. So we're really keen to push completion, as it's not only the largest staff engagement tool we have, but also because of that real helpful benchmarking. And so we are really pleased that our response rate has improved now for the last 2 years. So we feel in a really good position with that approximate 60% response rate across our organisation, that we can really rely upon these results and take action against them. And I hope Council of Governors would agree that there's much to celebrate in the survey results. So the completion of this survey was autumn 2024. And that was at a time when we were working with cost improvement programmes. And I think that we've had discussions that the fact that we've maintained a high performance in those results shows the strength of our culture, and how in-year challenges do not automatically mean that we're going to see a result in dip in how staff view working in the organisation. So all questions, as I said, are grouped under those 9 areas in the report, and LPFT scored the highest in 5 of those 9 when compared nationally with peer trusts, so with other mental health trusts, and also top in 3 of these areas across all 210 NHS providers, which is, as I said, something to be celebrated. And the paper does contain the detail in terms of which areas we've really excelled in. You'll see the paper also highlights where we're wanting to focus our efforts. And I think I would just like to emphasise to the council our commitment to the staff safety work. We have seen our results show the need for action in this area, and we have been and continually look to launch campaigns that target both staff and patients around our expectations in terms of bullying and harassment, violence and aggression and discrimination. And I hope that posters have been seen in staff areas, soon to come in patient areas, and that board members' communications has been seen as well around our expectations, and really encouraging reporting. We've also done more targeted communications to our leadership teams around their role in this, and we've heard our staff also say that we need a single point of access around staff safety support, and we are looking to implement a hub to address that, make it simple, and also ensure that the support our staff and managers receive is effective and timely. We also acknowledge in the paper that we are learning is a domain that we did not score as well as others in, and whilst we've done some work around establishing forums in terms of improving organisational learning, that domain does also include questions about individual staff learning, and so as the paper states, there's some focus in terms of management essentials and career development. And then finally, what I just wanted to point out really is not necessarily what the results say, but what we use the results, how we use them. And I just wanted to emphasise that we use the staff survey results and we triangulate them with other results and intelligence, which again is listed in the paper. So we really use it as one tool in order to determine where our focus is, so that we make best use of our resource, but also that we are likely to have a real impact in those areas. And like I think Sam highlighted earlier today in terms of iLogs, we do adopt a similar approach in terms of you said we did. So we close that feedback loop for staff so that they see the worth in completing it and feel we're listening to them. So we've definitely made progress in that over the years. And finally, we're really driving ownership and accountability, both of the results and of the actions that we then put in place. So moving away as seeing this as an organisational development team piece of work, to really driving that ownership and accountability throughout the organisation and throughout our governance. And we're making sure we're supporting with the right tools in order that people can really do that and understand their data. So that's it from me, Kevin. Thank you.
Thanks very much, Amy. Excellent report, and obviously very, very good results, which I invite colleagues to note.
Yeah.
Any questions or comments for Amy? No, I don't see any. So thank you very much again, Amy. Don't underestimate the amount of work that goes into kind of taking receipt of that, and as you say, properly triangulating the results from that and making sure that it feeds in to all of our other trust activity. So thank you very much for that. Let's move on then to the next item on the agenda. I'm struggling to get it in front of me, which is the Council of Governors Annual Appraisal. Karen.
Thank you, Kevin. So this is the first of two appraisals that I'm going to be presenting, and this is the Council of Governors Annual Appraisal. First of all, can I just extend thanks to those governors that did take up the invitation to complete the appraisal, but then more negatively comment on yet again, unfortunately, third consecutive year where we've had really poor uptake on this. It is really important that governors actually do take the opportunity to provide us with their feedback. You know, it's our way of finding or identifying ways in which we need to further support the governors to carry out their role and actually make improvements wherever necessary. But I'll try not to dwell on the negatives, and I'll focus on the positives. Hopefully it's a really comprehensive report, sets out the results for 2025 and also provides some comparator information. Also, and very positively, those that did complete the appraisal online provided a wealth of free text comments, which are probably far more valuable in many ways than the actual responses to the statements. So we can actually understand and maybe define what people or how people are responding much more accurately. I've attempted in the report to address some of the key themes coming out of those free text comments, and hopefully given some reasonable explanation or analysis of those. It would be probably quite impossible to address every single one, and again, some of them are less readily available, easy to understand necessarily what some we're trying to get across. So more than happy to take any questions and comments. Overall, good results, certainly on a par with the previous year. So those that did complete the appraisal actually feel quite positive in how they're carrying out their role and how the actual structure around them is actually supporting them. So I won't go any further, Kevin, just happy to take any questions or comments.
Thanks, Karen. I got Bex first.
Yeah, it was just a comment, Karen, just to say to people that we did have a by-election earlier this year where we did have quite a number of new governors coming into post. And in my experience, it does take a little while to actually get used to being a governor, mainly because you're getting used to something that you've never done before, usually. And so perhaps that might have been part of the low intake. 2026, here's hoping we get more responses.
I always remain positive, Bex. So yes, I'll go with that. Thank you.
Thanks, Bex. Helen.
Hello, Helen Smith, Staff Inpatient Governor. I'd just really like to say as well, similar as Bex, it does take a while for people to get used to completing things and having the confidence to actually, you know, put their opinions across. But on actually reading the survey and the people that, you know, various things that we were doing, when you read it, we are all very much singing off the same hymn sheet, you know, on the appraisals and everything that we're doing. So, and I think as well, looking forward, sometimes it's better to go with your own gut feeling, because, you know, that's what I do. I look at things from where we are, but looking at how the staff survey is and the appraisals and everything, we're not far off agreeing with each other the majority of the time. So it was good to read. So it's good to be part of a team that that is making big steps, really.
Thanks, Helen. Completely agree with those observations. Thank you. Now, Karen, this is for agreement by the Council of Governors, I think, isn't it?
It's to receive for information.
Just to receive for information.
Yeah,
okay.
Yeah, I mean, basically,
Okay.
they just need to consider the contents, which I think obviously people have done. Yeah.
Which we've done. Okay. So I don't see any further questions or comments. Then should we move on then to the next item, Karen, which is still with you, which is the training needs analysis.
Absolutely. Thank you, Kevin. And in a similar vein, and I should also say that I am very well aware that we did issue 2 requests for completion of appraisals around about the same time. So there is an element of potential survey fatigue. So I acknowledge that in the first instance. In relation to the training needs analysis, this is perhaps even more important because as an organisation, we have a statutory duty to ensure that we appropriately equip and train our governors to carry out their role effectively. So we can't do that unless we obviously check in with governors to check that they feel they have got the necessary skills and experience, or that we develop them where they don't feel they have. And this is just one way that we can actually establish that. We obviously do talk to governors, and it's something that's been the subject of conversation at previous governor development days. So in a similar vein to the annual appraisal, the results, the responses were fairly similar in terms of numbers, and equally the overall results reasonably positive. And again, a lot of free text comments, which actually were very helpful. I didn't feel that there was anything significant coming out of those free text comments that people felt that they were really lacking in. Certainly the one thing that somebody had mentioned was about actually interviewing. And I said in the report, we can easily address that and give people the skills necessary in-house to do that. And a number of governors do take part in interviews on the Trust's behalf. So again, more than happy to pass over for questions and comments, Kevin.
Okay, thank you, Bex.
Yeah, it was just a quick comment, and it was a case of, well, from at the beginning of what you had to say, Karen, that it's useful having both of them come through together, because then you've not got to go back in again and do another survey, and so you can do the 2 at the same time and get them over and done with. So I'll put that positive spin on it.
Thank you, Bex. Much appreciated.
Thank you, Bex. Any other questions or comments? If not, then let's take that report as received and noted. Thank you very much, Karen. The 2 more items, both of which are also with you. So sorry, it's a bit of Karen Scott show. The next one is the fit and proper persons test.
Thanks, Kevin. So this is the 2nd year that I've brought this report to the Council of Governors following NHS England's issuing of a new framework for fit and proper person testing. We had previously always carried out fit and proper person tests for our board of director members. However, there was further guidance issued and a much more robust and rigorous framework in which we have to comply with. So it's set out in the report. All of the necessary tests have been undertaken for all board members, and we have to be able to evidence those and keep a check of those electronically. And then Kevin, on behalf of the organisation, has to submit a declaration to NHS England to say that those tests and checks have been carried out, and that all directors that are on the board are currently considered to meet the fit and proper person test requirements. So this is really just here for information and assurance that we have complied with the framework and the guidance, and that we can say that our directors have passed all of those tests and checks.
And that's the
Thank you,
important bit,
Kevin.
isn't it? That we
Yeah.
carried out the process rigorously, and that we are all fit and proper people. I don't think there are any questions or comments on that. So we'll move on then to the last substantive item on the agenda, which is the review of codes of conduct.
Thanks,
Karen.
Kevin. So as Di Bailey alluded to previously under the Standards Committee highlight report, it was a single agenda item for that committee. It is that committee's responsibility to review these two documents, both very important documents, one for the directors and one for the governors. Many elements within each are reflected in the other. But there are obviously some differences for very obvious reasons. As Di alluded to, many of the changes were administrative, just bringing them up to date in terms of changes in role and title, etc., and also making sure that references to any legislation were correct. The committee was happy to agree them and recommend them to the board of directors, who has the responsibility for considering these for approval. The board of directors did do that, and both the documents are here for the governor's information, and to just basically alert them to the fact that subject to or post this meeting, we will be making sure all of those amendments have been updated in the documents, and we'll be circulating the respective ones to directors and governors for reviewing and re-signing. Thanks, Kevin.
Thank you very much, Karen. That's very thorough. Thank you. Any questions or comments on that? If not, then we will take them as being received and noted. Well, colleagues, that brings us to the end of the substantive agenda for today. I don't have any other business, and I haven't been notified of any other business from anyone else. So I am really grateful to everybody for their contribution and engagement this afternoon. Thank you very much for that. The next meeting is a face-to-face meeting at the Learning and Development Centre at Sleaford on the 23rd of October. So if I didn't see you before then, I will see you there. Thank you very much indeed.
Thank you.
Thanks.
Thank you, everyone.
Bye now. Bye.